Sleep is essential to good health, and it has a significant impact on weight management as well. Dr. Michael Mack joins us tonight to talk about the connection between sleep and obesity and how we can all get a better night's sleep. Diabetes Primetime is brought to you by Relion Community, an amazing program available exclusively for Walmart customers with a Relion Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Before we get started, let me know in the comments where you're watching from and tell us if it's your first time joining us. Dr. Mack, thank you so much for being here with us.
Thank you so much for having me.
So I'd like to start out by talking about why sleep is so essential for our overall health.
Sleep plays multiple very important health functions. So first off, when you're young, you're growing vertically. Your muscles and bones are being repaired. Brain development occurs in sleep. And when you're done vertical growth, when you sleep, certain parts of sleep, that's when the waste products of your brain get shuttled away. We also know that it's important for learning and memory consolidation. So we like to think that in one part of sleep, you're learning factual things that you might memorize on a test, like when's the inauguration date for the presidency. And then in other parts of sleep, you'll memorize and learn procedural things like how to play guitar or piano. So we know it's crucial to life. No human being can live without adequate sleep.
So what happens to the body when we don't get enough sleep?
A person that doesn't get adequate sleep is going to be more irritable. They might have poor impulse control. They might do things on a whim and regret things later. And also importantly, it screws up our stress hormone release. And that regulates also our appetite. So we know that people with interrupted sleep will eat, things that may not be the most healthy for us and eat at a rate and volume that's greater than what we should be doing. And lastly, again, sleep is important for muscle and bone repair. So without sleep, a person's immune system might be worse. They might be more prone to injury.
Are there long-term health consequences of consistently not getting enough sleep?
A person that does not get good sleep consistently is probably going to have more fatigue during the daytime. Their mental acuity, their ability to perform well, whether it's at school or at work, will probably be impaired. And we know particularly for young people that, can play, and unfortunately, a big role in a person's life in a negative way. A person can get sick more often because your immune processes are buttressed when you sleep. Your immune defenses are being built up. And without good sleep, that can't exist in the proper format. And of course, with long-term poor sleep, we know that people end up eating more calorie-dense foods. We know that leptin, which is a hormone that tells us not to eat when we're full, the secretion of that becomes impaired. There might be too much ghrelin, which is another hormone that tells us to eat. So your appetite becomes improper and a person can gain a lot of weight. And then for, those of us in school, your ability to learn might not be there. So I think those are the long-term consequences of poor sleep.
We're going to pause here and do our trivia question. Folks, we are giving away a delicious collection of breakfast recipes for anyone who answers our trivia question. All you have to do to get it for free is put an answer in the comments to this question. True or false, sleep apnea can cause weight gain? Is that true or false? Can sleep apnea cause weight gain? Put your best guess in the comments and you will get those breakfast recipes delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. So how can chronic sleep deprivation impact our weight long term?
Chronic sleep deprivation will likely cause a person to have unintended weight gain, all things considered. So first off, a person that has, sleep deprivation is less likely to be able to control their impulses, meaning that they might give in to their cravings for sweet and high carbohydrate foods. And we know that some of those types of foods can cause weight gain. Moreover, sleep deprivation will affect your body's insulin secretion and the insulin's ability to regulate your blood sugars, which means in the long term, a person's blood sugars can be worse and may lead to diabetes. And lastly, some of the hormones that are secreted that regulate our appetite, so leptin and ghrelin. The secretion of those hormones might be impaired, and the overall gross outcome might be unintended weight gain.
So we talked about sleep quantity. Let's talk about sleep quality. What would you say to someone who comes in and says, I'm getting 8 hours of sleep each night and I'm still tired all the time?
Most doctors will tell you, as an adult, aged 18 to 64, try to get in your 7 to 9 hours of sleep per night. Most of us are somewhere within that range. But if you're getting, like let's say, a proper amount of sleep and you still don't feel refreshed upon awakening, then that might be the time to ask for help from a health professional. It could be that you might have an underlying sleep disorder that's affecting the quality of your sleep. So namely things like sleep apnea, which is just a fancy term to say that the airways leading to your lungs can close up when you lie down to sleep at night. That's impacted by one's weight. It's associated with the increase in weight. Other conditions that can cause a person to have poor quality sleep despite adequate duration would be things like restless leg syndrome, which is a condition where a person has an uncomfortable feeling in their legs, not necessarily pain, but an uncomfortable feeling in their legs that prevents them from falling asleep or staying asleep. Generally speaking, it's worse at nighttime. It might go away with movement, but it definitely gets worse if you try to lie still. So those are other common reasons why a person might have poor sleep quality despite adequate sleep duration.
So let's talk about sleep apnea. What is it, and how might someone figure out if that's what they're experiencing?
Sleep apnea just means that the airways leading to your lungs, usually, in this area here, will close up when you lie down, and your airways and the configuration of such will interact with gravity. And if things are closed up, then there's no air going to your lungs. And if that happens more than 5 times an hour, then we call that sleep apnea. It will lead to things like high blood pressure, type 2 diabetes, heart attack, stroke, depression, and problems of memory and concentration. Symptoms, most common ones include, snoring. A bed partner or somebody that lives in your domicile might hear that, particularly if it's loud snoring. Bed partners may report that a sufferer has pauses in their breathing, and it can be very scary. So we often hear that spouses will, give them the nudge of life and wake them back up so that they start breathing again. The person themselves, they'll probably complain of daytime sleepiness. So, feeling very sleepy and tired during the daytime at inappropriate times. They might wake up feeling tired and groggy already. They might notice that their ability to remember and learn is poorer. And it often leads to, problems at work or at school. So presenteeism, where, your sleepiness isn't to a point where you can't show up, but your productivity isn't as good as it should be. And maybe in the worst cases, absenteeism. The person's sleep apnea has caused them so much cognitive impairment and sleepiness during the day, they're not even showing up. So, I think all those are important things to worry about. But, for me, I think, the cardiovascular outcomes are the most concerning.
Dr. Mack, we know that people with obesity are at higher risk of sleep apnea. What's the connection there?
People with a higher rate of obesity or overweight are at greater risk of sleep apnea for the reason when a person gains weight, for men, a lot of times it's in the stomach visceral area, we call visceral fat, central adiposity. In ladies, sometimes it happens in the thighs. But the point is that we don't get to control where fat deposition goes. And a lot of times some, increased weight will actually, develop in our airways, in our neck, and the soft tissues inside that line the airways leading to our lungs, and even the tongue. So because there's weight being deposited in these structures near the airways, it will make the airway more susceptible to closure due to gravity or just, by sheer size alone.
And what I hear you saying is obesity can make us more likely to have sleep apnea, but then sleep apnea itself can cause weight gain. So there's a little bit of a negative cycle there.
Yeah, unfortunately there is. Like, if you gained a little bit of weight, your apnea might be a little bit worse. And we know that, in people with, worse sleep apnea, their ability to exercise, their ability to stay active during the daytime can be impacted. One from being tired and being from sleepy. If I know if I'm sleepy or tired, I'm less likely to go to the gym or stay physically active. So there's a vicious cycle there. With greater fatigue and sleepiness from the sleep apnea, you're less likely to stay active, in which case your ability to regulate your weight might be impaired.
So let's talk about the good news here. Can reaching a healthier weight improve our sleep and potentially reduce sleep apnea symptoms?
When we think about treatments for sleep apnea, the gold standard historically, for the last 40 years has been CPAP, continuous positive airway pressure. So basically, we're using air, pushing the air through a person's airways and making a splint out of air so that the airways don't close. It works great, but at the same time, it's not for everybody. That's the best treatment, as we understand. There's all other treatments that are not CPAP, so they include getting a mouth guard from a dentist. Dentists can fashion mouth guards that treat sleep apnea by pushing your jaw forward by a small distance. There's pros and cons to that as well. So obviously there's a limit as to how far you can push a person's jaw forward to keep their airways open. It can cause, pain in your jaw, joint, maybe shift teeth. There is surgery that exists for sleep apnea. So maybe the more common one is the one that where the surgeon will take out your tonsils and adenoids, the pillars upon which they sit, and maybe part of the roof of your mouth that hangs down towards the back. It's what we call a UPPP, uvuloparingeal palatoplasty. The thing is, it's not a small procedure. Surgery comes with its, pros and cons itself. So that's not for everybody. There are more advanced versions of surgery too, but they're more invasive. And the thing that we tell everybody to do, the overarching treatment, is try to lose weight. If you think that your weight is not at a level that where it should be. So for people with higher weight than what they would hope for, that's the treatment that we tell people to engage in. And historically, it's not the easiest challenge to meet. It's very easy for me to talk about weight loss and ask people to lose weight, but to put that into practice and people do their best, it's just simply not that easy. Weight loss strikes at the root of the problem, which is we know that in many cases of sleep apnea that it's the increased weight that's the cause of the situation. So if we're able to lose the weight, then we may be able to solve the problem at its root.
So tell me about the role of weight loss medications and how you're seeing that they can help people with sleep apnea.
I think it's an amazing time to be alive, really. When you think about, medicine, how far it's come, we're very lucky to be, part of the world when we have medications that work really well to facilitate weight loss. And I think that opens up, like an avenue to an old treatment, but with, greater effect now, because now we have medications that can actually help patients achieve substantial weight loss in a way that was, not nearly as difficult as it was before. So we're sort of like in a renaissance period. We tell every patient to try to lose weight if they're overweight or obese, if they have sleep apnea. Easier said than done before, but now it might be achievable. And there are going to be a subset of patients where if they lose enough weight, they might not need to wear CPAP. So I think that that's a win for everybody.
In case you're just joining us, we're here with Dr. Michael Mack talking about the connection between obesity and sleep. And we're giving away a wonderful collection of breakfast recipes if you answer our trivia question, which is, true or false, sleep apnea can cause weight gain? Is that true or false? Can sleep apnea cause weight gain? Put your best guess in the comments and you will get those breakfast recipes delivered to your Facebook Messenger inbox for free. Folks, we do this show every month and we want to make sure you never miss an episode. Text the word WATCH to 844-966-1957 and we'll send a short text message to you reminding you when we go live each month. So Dr. Mack, what does a good sleep routine look like?
A great sleep routine, I think, starts with consistency. So I think everyone's heard that, you should probably wake up every day at the same time. Especially if if a person has like a different sleep and wake routine from Monday to Friday versus the weekend, which is, most of the people that we know, Monday to Friday, we're going to work, going to school, On the weekends, you want to relax a bit and sleep in. So, I know we all want to do that, but to get the best sleep possible, what I recommend is waking up every day at the same time. For the reason, if you have a different wake time on the weekend, as opposed to the work week, you're actually giving yourself an unnecessary social jet lag. So a difference in wake time is actually akin to giving yourself jet lag and traveling, to a different time zone. And we know how difficult that can get, particularly if you're flying east and you go to Europe or something like that. It takes a couple of days for you to settle in. Same thing applies, to that time differential when you wake up during the course of a week. So, my recommendation is for all people to wake up every day at the same time. And then the second question would be, well, what do you think about your sleep time then? Well, I'm going to tell you something that maybe not everyone else says, which is go to bed only when you're feeling sleepy. Because your sleep time and when your body and brain wants to go to sleep isn't going to be the same time every single day. It would probably depend on what you did during the daytime. If you had a very strenuous day, whether it's, physical because you went to the gym and had a hard workout, or mentally because you had a deadline to meet and you spent a lot of time writing that day and doing something that's mentally strenuous. On those days, you're probably more likely to want to sleep earlier, and you give yourself that chance. But compare that with a day when you've been totally relaxed and you're just hanging out with family, watching television or something like that. You might not feel the physiologic need to sleep until much later on. So you only go to bed when you're feeling sleepy. Other parts of a good sleep routine, it's good to exercise for your health, for your mental health and sleep health, but don't do it too close to your bedtime. So I would recommend that people avoid strenuous physical activity, at least 3 hours before your desired bedtime. Recognizing that if you're coming off, some aerobic exercise, you ran for 10 miles, it's going to take some time for your body to relax again to facilitate sleep. So that's the best way I can explain that. I would avoid eating large meals too close to your bedtime because that process of digestion might take away from your ability to fall asleep and stay asleep. And, this is a general health comment, and it would be to avoid the use of nicotine and alcohol. Again, too close to your bedtime. I tell people 3 to 4 hours before bedtime, don't do that. Other things that you might be able to control, the nature of your bedroom, where you decide to sleep. Have a comfortable mattress. Make sure there aren't any lights on because the lights affect your sleep. And in certain cases, certain types of lighting and wavelengths of light mimic the light from the sun, and it tricks your brain into thinking it's daytime. So why do you need to sleep now? So keeping your bedroom as cool and dark and as comfortable as possible would round up my recommendations.
For couples where one of the folks maybe has sleep apnea or some kind of disruptive sleep condition, do you recommend separate bedrooms for optimal sleep?
I think if the bed partner and the person that might have the sleep disorder can have higher quality sleep by moving into different bedrooms, I'm supportive of that. As long as that separation of the bedroom doesn't cause a separation in your relationship. So, unfortunately, when it comes to sleep disorders, many of them can be disruptive to the bed partner, not just the sufferer, but the bed partner. In the case of sleep apnea, the bed partner might be awoken by loud snoring. They might be alarmed by the gasping of the breath. In people with restless leg syndrome, they might feel the bed move or receive some kicks from the sufferer. And in other patients that we see, they have sleepwalking and sleep talking. They have complicated, complex nighttime sleep behaviors, and they might even get punches or kicks. So, safety is paramount, comfort is paramount. So in those scenarios, if it means that both partners can sleep with higher sleep quality, but on a different bed, maybe in a different bedroom, then so be it. But I would encourage that the person that has a sleep disorder that's caused this sort of split, see a health professional, get their symptoms treated, and then maybe one day reunite in the bedroom.
So, in other interviews, you've mentioned that you use a word search as a way to help you fall asleep. Tell us about that. And are there any other strategies you'd suggest for someone who has a hard time falling asleep?
So let's say if you've been trying to sleep and it feels like it's been a long time. I don't want you to look at the clock, right? Because if you look at the clock, anywhere, anybody in the world will do the same thing, which is you do mental calculations as to how much time I have in bed before I have to show up, where I have to show up the next day. So, you know, don't look at the clock. You don't look at your watch or whatever. But if it feels like it's been a long time and you're trying to fall asleep and it's not working out, or in a second scenario, which is if you can't sleep and it feels like it's been a long time, go to a different room that's dimly lit and do something boring like a word search. And I say word search because, this is where you have a sheet of paper with all the jumbled up words in there. You circle them horizontally and, vertically and diagonally. Well, all the answers are on the page. If you did a crossword puzzle, people invariably, find a hint that they can't solve, and that riles you up. Don't do Sudoku, because math unanimously worldwide is, riles up people. So, and then nobody keeps, books or magazines they don't like in their homes. So you might just finish Harry Potter, over the course of the night. That's not good either. So do the word search, and maybe every 15 minutes you're going to feel that natural wave of head nodding, sleepiness, which is your cue to go back to bed. And I think that that's a great way to break that association between you struggling to sleep in your bed, and now you're going to associate it with, feelings of tiredness and sleepiness that allow you to sleep in bed, which helps with the treatment of insomnia.
Do you recommend naps for your patients who experience sleepiness during the day?
I would say this, that if it's at all possible to get through your obligations during the daytime without napping, then that's what I would encourage a person to do. For the reason our brain does a really good job of counting how much sleep we receive in a 24-hour period. And if you have a substantial sleep period during the daytime, that might get subtracted from your nighttime sleep. And, based on how the world works these days, and, we have, activities during the daytime when it's light out, and, we're expected to rest when it's dark out. So by napping during the daytime, you might be taking away from your nighttime sleep. It might be a cause of insomnia. So we actually tell people that have trouble falling asleep and staying asleep not to nap. But then the flip side of this is, if you have a person that's so sleepy during the daytime, maybe they also have sleep apnea, that their sleepiness during the daytime might get them into trouble. So let's say if you're driving a vehicle, and hopefully you're not going to do that while you're sleepy, or you have a lot of deadlines you have to meet. You work in a safety sensitive type of occupation. Then push comes to shove, have the nap, but make sure it's very short. We like to tell people that keeping your nap 20 minutes or less is optimal. That way, we hope that it won't affect your nighttime sleep, but also it prevents you from reaching deep sleep when your brain waves are extremely slow. And when you wake up from that, you feel groggy. Sometimes people feel drunk. Sometimes you'll wake up and you don't know where you are. So by keeping your naps short during the daytime, that is the optimal play.
Dr. Mack, anything we haven't covered that you feel is important for people to know about the connection between obesity and sleep?
I think that everybody knows that good diet is a key to a pillar of good health. Exercise is one. And the thing that I want people to forget is that sleep is that other pillar. That's extremely crucial to good health. With good sleep, you'll have good physical and mental health. You'll have a better cardiovascular system. You'll be less likely to have depression, anxiety. Your ability to learn will be optimized. Your ability to function in life will be optimized. So get your 7 to 9 hours in.
Dr. Mack, thank you so much. This has been such an informative conversation.
Thank you.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, sleep apnea can cause weight gain? The answer is true. If you didn't get to answer the trivia question, but you'd still like those breakfast recipes, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.